Leeds Fertility, and to this video, which is the first in our series aimed at patients who will shortly be starting their first IVF cycle with us. This series will help you to understand the pathway that you will undergo. It will answer a lot of common questions and hopefully ease any anxieties that you may have. My name is Dr. Catherine Hayden. I'm one of 5 consultants and specialists in reproductive medicine. Leeds Fertility is one of the largest and most successful reproductive medicine clinics in the UK. You don't have to take my word for that. Check out our regulators at hfea.gov.uk for validated results. We're proud of our success and that we're able to offer the full range of fertility treatments to both NHS and self-funded patients. We've operated out of the Seacroft Hospital site of the Leeds Teaching Hospitals NHS Trust since 2010, but have a track record that goes back to 1991 when the first assisted conception clinics were set up at the General Infirmary at Leeds and St James's University Hospital. This presentation is produced to help existing and potential patients to familiarise themselves with the practicalities of IVF treatment under our care. For most people, the prospect of IVF treatment is daunting. We believe that a clear understanding of the process is the first step to allay the majority of anxieties. The hardest part of this treatment is the uncertainty of success. We will do our best to support you through the straightforward and the tricky bits. I'm going to explain the IVF process in a stepwise fashion to help you to understand the background and the legal context to this treatment, to outline potential problems and risks and the things that we do to minimise them. I recommend that you refer to the IVF ICSI patient information booklet, which is available on our website and in hard copy at the clinic. Our staff complement is approximately 80 individuals covering all aspects of the service. The team is large but friendly, and our goal is to make your journey as smooth as possible. This is the waiting room reception area at Leeds Fertility. A significant part of IVF monitoring involves internal or transvaginal ultrasound scanning, and this is one of our private scan rooms. The first contact that you will have with us is usually in the outpatient clinic, and it's here where we work out why you may need IVF treatment. To understand why IVF is needed, it's important to have a basic understanding of what happens in natural conception. During each female monthly cycle, a woman releases one egg from one ovary from the fixed supply that she was born with. The egg takes 2 weeks to get ready to be released or ovulated, when it's picked up by the fallopian tube and carried towards the womb. It meets the sperm in the tube and fertilisation happens here. The embryo or fertilised egg then attaches to the womb lining 5 to 7 days later and a baby then develops. The process is coordinated by hormones. These are natural chemical messengers. FSH and LH hormones are released from the brain into the bloodstream and stimulate egg development and ovulation in the ovary. Estrogen and progesterone hormones are released by the ovary and prepare the womb lining for a pregnancy. There are many reasons why pregnancy doesn't happen easily or at all for some people. It's very common for there to be more than one reason. The fallopian tube can become blocked or damaged, especially after infections or with endometriosis, or after abdominal surgery. Blockage is usually diagnosed with an X-ray called an HSG, or an ultrasound called a HICOSI, or in a laparoscopy operation under general anaesthetic. IVF can help by bypassing the fallopian tubes altogether. Hormone blood tests and ultrasound scans help to identify if there's a problem with the ovary and the eggs that it houses. Irregular or absent monthly periods are a typical sign. Or there may be a problem with the number and the quality of the eggs remaining in the ovary. We call this the ovarian or egg reserve. Aging naturally reduces the egg reserve, making it take twice as long to get pregnant at 37 that it would have done at 27 when there is nothing wrong with either partner. Aging affects the number of available eggs and also their quality. Many eggs are simply unable to fertilise and go on to develop into a healthy baby. The IVF process can increase the number of eggs available at a given time, but it doesn't improve their quality. Some women may have a reduced ovarian reserve at a relatively young age. This may be caused by endometriosis affecting the ovaries or previous surgery, or it can run in families. We can assess egg reserve with hormone tests and by counting the number of follicles present in your ovaries at a given time with ultrasound scanning. Your GP will do the FSH test, which should be done at the beginning of your period. There is another test called AMH, which can be done at any time in the cycle. This test is not available on the NHS in Leeds, but we are able to send blood to a private laboratory from Leeds Fertility for £80. These tests help us to personalise your IVF programme to give you the best chance of success in the safest way. If the sperm are relatively few or not swimming strongly enough, or contain a high proportion of faulty ones, then we can look down the microscope and identify single sperm that appear to look normal in shape and movement and inject those directly into an eggs. This process is called ICSI. Sometimes we will perform all the available and appropriate tests in the outpatient clinic but still not be able to identify an obvious reason for the delay in pregnancy. This is reassuring on the one hand but frustrating on the other, and we call this unexplained infertility. IVF is often the next step under these circumstances, as it does increase the chances of pregnancy or indeed shorten the time to a positive test being achieved. Sometimes the IVF process itself serves as another test, allowing the eggs to be inspected for the first time under a microscope. New information may explain why a pregnancy was not happening under natural circumstances. Other tests may be offered in individual cases, especially if there are other medical conditions being managed. Moving on to the tests themselves. Most couples will have all of these tests done to reach a diagnosis. Sometimes the tests need to be repeated as they can change over time, or the detail may be missing, particularly in ultrasound scans. We'll discuss the need or not to test your fallopian tubes and the ways in which this can be done in the context of your particular situation. When we have all the information we need, we'll be able to provide personalised treatment recommendations for you. This slide shows the basic steps of the IVF process. Hormones taken by the woman as injections cause the ovary to make several eggs grow at the same time. The eggs are then taken from the woman's body in a minor surgical procedure under sedation, which is called the egg collection. The eggs are put together with the sperm in the laboratory for fertilisation to take place. This is when the sperm enters the egg and the contents are combined to create a unique human being. If ICSI is advised, the sperm are injected individually into each of the mature eggs collected on the same day of the harvest. The fertilised eggs, which are now called embryos, grow under observation in the laboratory for between 2 and 6 days. A process of selection takes place during this time to identify as far as possible the embryos with the best chance of continuing to develop into a baby. One embryo is then transferred into the woman's womb in a procedure that feels a bit like a smear test. After the transfer, further medicines are taken to give the embryo every chance to implant. If the treatment has been successful, a standard urine pregnancy test will be positive 2 weeks later. The first pregnancy ultrasound is performed 3 weeks after that. By this stage, the pregnancy sac is large enough to be seen on the screen and a flickering heartbeat should be identifiable. Once the decision has been agreed with you in the outpatient clinic that IVF is the way forward, your next step will be to make an appointment with one of our nurse specialists for a nurse consultation appointment. This is the gateway into your treatment cycle where your personalised plan will be mapped out and explained. I'm now going to move on to talk about some of the legal aspects of treatment. All fertility clinics in the UK are licensed by the Human Fertilisation and Embryology Authority. You can find them online at hfea.gov.uk. They issue a code of practice and inspect clinics regularly to ensure high standards are maintained. They require certain formalities to take place, particularly in relation to consent to all the different steps in the IVF treatment process. We're also required to make sure we give due consideration to the welfare of any child that may result from our treatment and to the welfare of any existing child who may be affected by our treatment. When you attend the outpatient clinic, we will have asked you to fill in and sign 2 important documents. The first is regarding confidentiality. All information regarding your fertility treatment is strictly confidential, and we can only communicate with your GP and/or the referring consultant with your written consent. You have the right to decline consent to share your fertility information, but we need to consider the reasons why you may wish this. Generally, we advise that you keep your GP informed of the process of your treatment in case you need them in an emergency. In respect of the welfare of the child that may come about as a result of IVF treatment, we need to consider issues such as the couple's commitment to having and bringing up a child, their ability to provide a stable and supportive environment, to the couple's own medical history, their health, ages, and their ability to nurture a child. We also need to think about any risks to a future child, including inherited disorders, transmissible diseases, as well as safeguarding issues such as abuse or neglect. There may be times when issues come to light that we feel require more detailed inquiry, and we have the facility to do that with your complete inclusion and cooperation. It would be extremely rare for us to need to resort to the Hospital Ethics Committee for guidance, but the structure is there if needed. As you prepare for your treatment and your nurse consultation appointment, there are some things that you can do to maximise your chances of the treatment proceeding without a hitch and to give you the result that you're hoping for. We're asked both partners to stop smoking completely. There are no clearly defined safe limits for alcohol consumption, so generally speaking we recommend that people try to stop altogether. Body weight is important and makes a difference to the chances of success. Ideally, the woman's BMI should be under 25. To access NHS funding, it must be under 30 for most funding bodies or CCGs, clinical commissioning groups. The Vale of York require a BMI of 29 or under for 6 months prior to treatment. If you have any other medical conditions such as asthma or diabetes, please make sure that these are stable and that you have discussed pregnancy with your specialist. Some medications may not be advisable or safe in pregnancy and may need to be changed. Your cervical smear must be in date and you must be immune to rubella. Your GP will have these test results on your file. All women should be taking preconception folic acid and vitamin D supplements. For most women, over-the-counter preconception's multivitamins will be sufficient, but for some, higher doses of both of these are needed. We will advise you specifically. Some women can have an underactive thyroid without any symptoms. We check this for everybody and recommend additional thyroxine hormone tablets if necessary. We will advise you and your GP, who prescribes and monitors the hormone level, if this applies to you. If any of these preparatory steps are missing, we may have to delay the start of your treatment. If you have any specific concerns or queries, please write them down and your nurse will be able to help you at the nurse consultation. With regards to the consent for IVF treatment, when you come for your nurse consultation, we will confirm that you've given us communication consent and that we have had the welfare of the future child consent forms signed already. You will then need to complete a series of consent forms for your treatment to take place. These will need to be completed by both partners. We use an online package called Engaged MD to help us manage this. We will provide you with unique login details which will give you access to some background information about the legal forms you're going to sign. Please allow yourselves plenty of time to do this in advance of your nurse consultation. It takes most couples between 3/4 and an hour to fill out their forms. If you produce more good quality embryos than you can use in the first treatment, then these embryos can be frozen. You will need to consider what might happen to these embryos in the future. In particular, we need you to think about whether you would want the woman to use these embryos in the event of her partner's death. This situation has sadly occurred and both partners need to agree about embryos that belong to both of you. Because the option to allow the surviving woman to have an embryo transferred has significant implications for that woman and the potential child, we require the matter to be discussed with one of our counsellors before such a plan can be agreed to. The absence of legally binding consent has meant that eggs, sperm and embryos have had to be discarded in the past. When you attend for your nurse consultation, we will register you on the confidential HFEA register. Every cycle is recorded from when it is started to its end, which may well be a year down the line. This enables the authority to track every clinic's performance and publish these results for all to see. The next 2 slides cover some information about how the engaged MD process works and what you will need to do to be able to work it properly. It is possible to sign the consent forms electronically. Moving on now to support services. We know that IVF treatment is a stressful process, and we have a number of measures in place to help manage the stresses and strains of infertility treatment and its aftermath. We have a team of expert fertility counsellors who work with us at Leeds Fertility, who help patients to become familiar and give due consideration to the psychological and social implications of some of our treatments. They provide valuable support in decision making and coping with the ups and downs that all patients experience. There are times when we will refer to the counsellors as a requirement of our HFEA licence. There are times when we may recommend a referral, and you may request a referral or refer yourself at any time. What you discuss with the counsellor is confidential, unless there are issues raised that have implications for the welfare of the potential child. These will be shared with your consultant in order to determine whether or when treatment should proceed. You may also find it helpful to make contact with various social media forums for patient-to-patient support. Infertility Network UK is a highly recommended resource for patients. And finally, for this section, a brief word about infections and viruses in particular. Some viruses can be transmitted to the unborn child and cause significant health problems. We test all patients for hepatitis B, hepatitis C, HIV and syphilis to ensure that the laboratory environment cannot be a source of transmission between patients. In recent times, other viruses have come to the fore that have impacted on fertility treatment. Some have longer incubation periods than others and mean that fertility treatment cannot begin until that incubation period has passed and it becomes apparent that an individual has not contracted that virus. The currently advised timeframes for Zika, Ebola and COVID-19 are shown here.